at further risk with respect to being exposed to COVID at this very critical time. Now, it is instructive though that there is at the moment, as we have seen, there are still some persons who, for whom, um, and as you know, Madam Chair, within certain demographics of, of where we are, that there are some persons who, no matter the age, and as a medical doctor, you are well aware, there are certain persons who will either not want to seek medical attention at all or seek medical attention, certainly when it is particularly late. And we have been encouraging, not just the companions, but all of us as members of parliament have been encouraging um, elderly persons across the communities in Barbados to get themselves vaccinated, to avail themselves of the healthcare provisioning that is available to them so that we can save as many lives as possible. And I believe that um, we have to try to reach more people within that demographic with the message, because for too many people, Madam Chair, the decisions that they have taken with respect to either not getting vaccinated or not, in a sense, following the public health guidance has meant that, regrettably, too many persons have passed away when they needed not to. And I think that the merit of this program, I think, remains very strong in terms of the intent from the government side to make sure that we can go into communities and identify and help urge people to avail themselves of all the healthcare that is available. In the context of COVID, I really do want to encourage persons to cooperate, certainly with the companions. The government's intent really is to try to save as many people as possible, and I know that they've been doing good work across the country. But it is up to individuals and their families to seek to seek the appropriate advice. I take this opportunity, Madam Chair, because I know it's something that has come up in the context of elderly persons, and as a physician, you are well aware of some of these issues better, certainly better than I can articulate. But in too many instances, we've had persons making decisions on behalf of elderly persons where perhaps there may be some legal question with respect to their ability to act as power of attorney to determine what course of action could be taken. And I really want to encourage families to not deny their elderly relatives the appropriate care and access. And I don't want necessarily to descend into whether it's a legalistic issue or not, but not to deny people care that could lead to adverse outcome in which I think may have contributed to a number of persons regrettably passing away. And I know that as a member of the medical profession, you want to make sure that your colleagues are able to provide the best care possible to everybody, and the extent to which certainly COVID has created confusion for persons. We really want to implore families to seek the best possible advice from the medical professionals actively, rather than it being a case where it is hearsay, so that at least persons can have greater access, particularly at a time that is particularly important, and really not check up on your elderly relatives and encourage them, Madam Chair, to seek medical attention. I think that has been our strong message to the public. I want to reiterate it from this place. So whilst we're here to discuss, in this context, the provision of national insurance contributions for the persons participating in the program, I believe the work that these persons are undertaking is particularly important as we help to manage the pandemic. And we really want to encourage families now to think of their loved ones and to encourage their loved ones, Madam Chair, to seek the appropriate medical advice, either through you, persons like yourself, the GPs in the communities, reaching out to the healthcare system, other private doctors, to avail themselves of that advice. And I believe that if more and more persons encourage the elderly relatives to do that, or, Madam Chair, in some cases, as I know a few friends of mine have done at home and abroad, is quite frankly to give their elderly relatives clear instructions as to what to do. Because sometimes people are confused, and whilst I know that some of our elderly population are set in their ways, as we would say, sometimes we have to be a little patient on the one hand, but sometimes people just need some decisions made with respect to what needs to happen. And I think that we do so in the best, what we believe is in the best interest of our elderly relatives. And I think this program certainly gives, along with all the other interventions that are being undertaken, gives us the opportunity to reach as many elderly persons within the country, to help them to come to a decision point where they can either get vaccinated, stay or stay safe with respect to the observance of the protocols, given the number of comorbidities that may exist depending on your age cohort and your profile, so that people can survive this pandemic. And this provision here, Madam Chair, is just to allow us to be able to continue to provide that service. And I think that it is important that we recognize that in this pandemic, we have to all pull our weight with respect to deal with the public health side, but I think more importantly, Madam Chair, to allow us to focus on those persons who are truly vulnerable, and the extent to which we can all act as family healthcare providers to help protect those persons, particularly those who may be bedridden, who are not going anywhere, that we can do what we can to protect them so that they can be with us, Madam Chair, for considerably longer. And so, Madam Chair, with those few words, I beg to move that Head 35 in the Head 35 stand part.
Question is that Head 35 stand part. All honourable members in favour, please say aye. Aye. All those against, please say nay. Methinks the ayes have it.
Head 81, Ministry of Transport, Works and Water Resources, $9,169,519.
Honourable member for St. Michael West Central.
Thank you, Madam Chair. In moving the supplementary under Head 81, I believe the Minister of Finance would have spoken to the issues, but I wish just to say briefly that the government, in recognition of all the hard work being undertaken by the workers who do such yeoman service for Barbados in the National Cleanup Campaign, that the government felt it absolutely necessary to come to this honorable chamber to ensure that it fulfill its obligation as an employer, to ensure that we fulfill the national insurance obligations. Mr. Speaker, it is without doubt that as we, Madam Chair, sorry, I apologize. It is without doubt that as we move around Barbados, I think it's for all of us to see the works being performed by a team of men and women who've done so much for Barbados. The National Cleanup Campaign, Madam Chair, if I may just go back for a second, evolved around the need for the country to clean up after the volcanic ash that spread to every nook and cranny in Barbados. And as a result, the country had to be cleaned up. The government had to engage several workers, close to 1,300 workers, in order for us to not only clean up, but to keep the country free of debris And the workers did, like I said, a wonderful job in executing the mandate. Now, as it relates to the output, the government further recognized that it had to continue the program in order to maintain a very clean country. And I think most Barbadians, if not all, would agree that as you move around Barbados, you're seeing a country that is clean and green. And I want to say, Madam Chair, that had it not been for the work of these men and women in the program as part of Head 81 under the Ministry of Transport Works and Water Resources, I fathom to think what Barbados would have looked like. So I'm very pleased, Madam Chair, to stand in this honorable place and to thank the Ministry of Finance for bringing this supplementary here to support not only the work, but to ensure that the contributions for those men and women who work in the campaign will be duly paid. Mr. Speaker, I think it is without doubt that we have a lot to be proud of in Barbados. And I say that from where I sit, not because I'm the minister at this time responsible for the ministry, but because I go to work, but I also have an opportunity as I drive around Barbados to see the wonderful, the hard-working men and women cleaning up Barbados. And Mr. Speaker, Madam Chair, apologize, that when we walk around and when we drive around Barbados, that those workers have been so instrumental in cleaning up Barbados that at times when you have significant rainfall, you do not have a lot of flooding in Barbados. In fact, the drains are clean, the French drains are clean, the box drains are clean. We are moving grass, debris that would have otherwise blocked the wells that the water would have naturally flowed into. But when we walk around Barbados, and when we drive around Barbados, Madam Chair, we see that after significant downpour, the water will run off. So I don't think there's much more, and I don't want to delay the chamber unduly, except to say that a wonderful initiative to employ as many people as we have employed, and particularly at a time when the country is, like the world, faced with a significant pandemic, and where obviously jobs will be a little difficult to come by because of diminished activities from abroad, that the government had the foresight, they had the vision to ensure that we not only clean up Barbados, but that we ensure that we look after the very workers who looked after Barbados. And Madam Chair, on that note, I wish to move that Head 81 stand part.
Question is that Head 81 stand part. All honorable members in favor, please say aye. All those against, please say nay. Methinks the ayes have it.
Head 82, Ministry of Environment and National Beautification, $3,929,300.
Honorable member for Christchurch East Central.
Yes, Madam Chair, the similar to the provision in the previous head, as you are aware, there's been a sustained program to deal with debushing across the country for some time. And this provision is similar to Head 81 in that vein. Let me take this opportunity to remind the public that in everything that we've been able to try to respond to, we've been pretty consistent in terms of ensuring that we can resolve these matters in as timely a matter as possible, and the extent to which certainly the national beautification effort, the matters in relation to the botanical gardens in matters in relation to the contractual workers, that these provisions are designed specifically not just to deal with the national insurance contribution, but certainly to support a situation where all of these persons who have been engaged rightfully, Madam Chair, would be able to access any of the national insurance benefits that are available to ordinary persons without fear or contradiction as part of this process. I really want to thank the honourable member for St. George South, particularly because, as you are aware, as a representative of workers in this country, the reality is that we have had to ensure that we not just tighten up, but make sure that the necessary provisions are made to provide the coverage that these people certainly deserve. And I want to take this opportunity to say to Barbadians that whilst we are making these provisions now, the context within which obviously we were unaware as to the duration of the length of time, and there's no excuse for that, Madam Chair, but we are in a position now to make sure that we make wrong things right with respect to the provision of these national insurance contributions. We are doing so conscious that whilst there's uncertainty with respect to how long the pandemic may continue for, that we have to make the necessary provisions to be able to ensure that the terms and conditions obviously meet with what will be standard contractual arrangements. And so, Madam Chair, I know that there are many programs for which we are provisioning for, but the reality is that, as consistent with our social security intervention and policy arrangements, these monies are being requested to make sure that we can cover those contributions, and therefore these persons will have, like everybody else, the appropriate coverage like all of us would under normal circumstances. And so, Madam Chair, I beg to move that Head 82 stand apart.
Question is that Head 82 stand part. All honourable members in favour, please say aye. All those against, please say nay. Methinks the ayes have it.
Head 87, Ministry of Education, Technology and Vocational Training, $7,323,801. I beg your pardon, $1,323,801.
Honourable member for Christchurch East Central.
Yes, Madam Chair, I almost got very nervous just now. But no, seriously, Madam Chair, as you know, and this supplementary just outlines the different level of responses that the government has had to manage in this process, and the establishment of the school monitor program to be able to help mitigate the spread of COVID-19 within schools, even though, yes, we've had to revert to an online process. It is certainly, as I understand it, the intention of the Ministry of Education and Ministry of Health to be able to move back to face-to-face school in January. And we have been working certainly to be able to put in the appropriate testing, as well as obviously I know that at the moment a determination has been made with respect to 12 to 17-year-olds as it relates to vaccination. And we hope that we can get back to online school, face-to-face school in January to be able to help ensure that the education of our children continues without further distress. As it stands right now, obviously the numbers have been reducing, and I think we all have to come to grips with the fact that COVID will be with us, and therefore the decisions that we take as individuals as we go about in our daily lives, that the reality is, Madam Chair, based on where we were, and I'm not an expert in any of this, but where we've had these significant number of cases in country, I'm not sure that you're either safer at home in your communities, at church, at work, at school, wherever. And the truth is, Madam Chair, is that there will be cases. Our focus going forward now has to be on mitigation and preventing people from dying, as I said earlier when I spoke on Head 35, as it relates to protecting the most vulnerable persons in the community. And therefore, I know that there's been a lot of discussion, and I know that all of us would love to see our children go back to school in an environment that allows them to be able to learn. And I hope that between the Ministry of Education and the Ministry of Health, that they can work out the appropriate protocols that will allow for that return to school, and recognizing that there will be risks going forward. And whether it is Omicron or any other variant that comes about, that the level of vaccination that is required in country, the following of the protocols will remain until something else perhaps comes into the arsenal, in the toolkit, for us to be able to leverage that vaccination and following the protocols is what we have to work with. And therefore, we cannot continue to function in the same way that we were functioning earlier this year, given that we do have tools within our toolkit, the ability to mitigate risk. Regrettably, as it stands, there will continue to be cases, and I think as we refocus on not just the reopening of the economy, but certainly the resumption of school and other service delivery, we must recognize that there will be cases, and how we manage that, Madam Chair, going forward in bringing back a level of regularity that, as it stands at the moment, that we have to focus on how do we get our children educated. And this school monitoring program, Madam Chair, has been important in allowing us to at least help enforce the protocols whilst children have been at school for the time that they've been at school. I think it's been a valuable contribution, despite the fact that we've had to revert to the online process this term. But I hope that as we are able to better understand the trajectory of the pandemic and the level of illness, that we monitor not just our local data, but certainly supported by international studies and what have you, that we're better able to make decisions with respect to how school can resume. I know that the testing regime with respect to school is potentially being worked on, and that this is going to be the new normal, Madam Chair, for some time. And therefore, getting children back to school, this school monitoring program will be a part of that to help mitigate and enforce the protocols. And I encourage all teachers, all parents, all administrators to make sure that we do all that we work together to ensure that we can get our children back to school safely, be able to receive their education, obviously sit their exams, and enjoy a new level of experience as it relates to school, so that we can get on, Madam Chair, with the normal provisioning of educational services for the country. And so this is going to be important. This is an important program to help mitigate against the spread of COVID-19. And therefore, Madam Chair, with those very few words, I beg to move that Head 87 stand part.
The question is that Head 87 stand part. All honorable members in favor, please say aye. All those against, please say nay. Methinks the ayes have it.
Head
93.
93, Ministry of Housing, Lands and Maintenance, $922,681.
Member for Christchurch East Central.
Yes, thank you very much, Madam Chair. Again, similar to the other heads, as you would recall, following the asphalt in April of 2021, the NHC had to engage a number of workers with respect to being able to deal with all of the estates that the NHC manages, all of the housing estates and the property of the Crown, in terms of being able to deal with that, and the extent to which we've beyond that in terms of, and then very shortly after that, we've had the, as you know, the Ministry of Housing is coordinating the repairs as it relates to Hurricane Elsa, and therefore the provision here really it was to be able to respond to that specific program, to respond to the ASH and the repair and effectively the repair program as it relates to the Ministry of Housing and the NHC. But the reality is that it is, again, part of government's need to constantly respond to things that are changing, and the extent to which we have been able to successfully execute, I think, is commendable on the part of the government. Of course, it takes resources to be able to make these provisions, but I want to give the public the assurance that where adjustments need to be made within the context of the budget, that we continue to monitor, because it is absolutely important, Madam Chair, that government must always be in a position to respond as needed and to be as nimble and flexible to the needs of ordinary Barbadians. And as you can see throughout this entire resolution, there has been specific things that had to be responded to, that the government has been able to do, and we're just making sure that for the persons who have been engaged specifically to deal with these very temporary programs, that the appropriate national insurance contributions are made in a timely manner in order to make sure then that these persons are not in any way disadvantaged. And therefore, to the extent that we are here with respect to this particular head, again, nothing that was planned in the context of when we started this financial year, and therefore, with respect to the engagement of these persons, these sums of monies here, Madam Chair, are to cover the national insurance contributions for these persons, and therefore allow them not to be disadvantaged like anybody else. And so they have been doing good work, and I hope that we can get the works completed such that Barbadians can see a sense of relief and benefit from this particular exercise. And so, Madam Chair, I beg to move that Head 93 stand part.
Question is that Head 93 stand part. All honorable members in favor, please say aye. All those against, please say nay. Methinks the ayes have it.
Madam Chair, I beg to move that you do now report to His Honor the Speaker the passing of one money resolution in committee, in Standing Finance Committee.
Beg to second that.
Question is, I now report to His Honor the Speaker the passing of one money resolution in Standing Finance Committee. All honorable members in favor, please say aye. Aye. All those against, please say nay. Methinks the ayes have it.
The chairman of committees is reporting the passing of one money resolution in Standing Finance Committee.
Mr. Speaker, I beg to move that this resolution be read the first time.
The question is that the aforementioned resolution be read a first time. All those honorable members in favor, please say aye. Those against, please say no. Meeting the ayes have it.
Mr. Speaker, I beg to move that this resolution be read a second time.
Question is that the aforementioned resolution be read a second time. All those honorable members in favor, please say aye. Those against, please say no. Meeting the ayes have it.
Mr. Speaker, I beg to move that this resolution be now agreed to.
The question is that the aforementioned resolution be now agreed to. All those honorable members in favor, please say aye. Those against, please say no. Meeting, the ayes have it. This resolution stands passed.
Speaker would like to recommit papers.
Honorable member for St. Joseph.
Mr. Speaker, I'm commanded to lay the Planning and Development Environmental Impact Assessment Regulations of 2021. Right.
Government business resume.
Mr. Speaker, with that, we've come to the end of our business for today. I beg to move that we adjourn this sitting of Parliament until the 14th of December at 10 in the morning.
The question is that this chamber stands adjourned until Tuesday, the 14th day of December at 10 a.m. in the forenoon. All those honorable members in favor, please say aye. Those against, please say no. Meeting, the ayes have it. This honorable chamber stands adjourned until Tuesday, 14th day of December 2021 at 10 a.m. in the forenoon.